Hey, it's Michelle. Welcome back to another video. So in the video today, I want to share with you 20 signs and symptoms that patients commonly report. And I've grouped these terms into 6 categories. So the first category we're going to start out with is the signs and symptoms related to the head. So the first term in this category is fatigue. Fatigue. An example of how this may be heard is the patient may say, lately I've been feeling this constant fatigue no matter how much I sleep. Number 2, dizziness. Dizziness. Or the more medical term is vertigo. Vertigo. So dizziness or vertigo is when you feel like your surroundings are spinning around you when nothing is actually moving. So the patients may sometimes actually describe dizziness or vertigo by saying, I feel like the world is spinning. Or they may say something like, lately I've been experiencing dizziness so severe that I vomit. Number 3, lightheadedness. Lightheadedness. So lightheadedness is different from vertigo or dizziness. So lightheadedness is when the patient feels like they're about to faint or when they feel like they're about to pass out. So an example is the patient may say, I feel like I'm about to faint. I feel like I'm about to pass out. Or, I feel lightheaded whenever I rise from a sitting position. Number 4, forgetfulness. Forgetfulness. Example is, I've noticed that I've been getting really forgetful lately. Yesterday, I just forgot the password to my phone. Number 5, headaches. Headaches. Or migraines. Migraines. So an example is, after starting the new medication, I've been experiencing frequent headaches. Or, I've been experiencing these excruciating migraines ever since a car accident. Number 6, blurry vision. Blurry vision. Or, blurred vision. Blurred vision. Example, ever since the dosage of my medication was increased, I've been experiencing blurry vision throughout the day. The second category is signs and symptoms related to the chest. So the first term is chest pain. Chest pain. Example is, I was out hiking with my wife when I suddenly experienced this crushing chest pain. Number 2, irregular heartbeat. Irregular heartbeat. Now the thing is, patients don't usually say, I'm experiencing irregular heartbeats. They would usually instead describe what they're feeling. So for instance, they may say, I feel like my heart skips a beat. Or, I feel like my heart isn't beating right. The third category is signs and symptoms related to the abdomen. So the first term is nausea. Nausea. So the patient will probably say, I'm feeling nauseous. Number 2, vomiting or puking. So for instance, the patient may say, I feel like I'm about to vomit, or I feel like I'm gonna puke. Number 3, stomach ache. Stomach ache. Or upset stomach. Upset stomach. So the patient may say, I have a stomach ache. Or, I have an upset stomach. Or they may just say, my stomach really hurts. Number 4, heartburn. Heartburn. An example is, I've been experiencing heartburn after eating. The fourth category is signs and symptoms related to eating. So the first term is dysphagia. Dysphagia. And that's just a more medical term that means difficulty swallowing. Difficulty swallowing. So an example is the speech language pathologist, Sam, is going to teach the dysphagic patient swallowing exercises to improve her swallowing. Another example is the patient may say, ever since my stroke, I've had difficulty swallowing. The second term is lack of appetite. Lack of appetite. So an example is, I haven't really had an appetite lately, and actually last month I lost 20 pounds. The fifth category is signs and symptoms related to urination. So the first term in this category is frequently urinating or frequently peeing. For instance, the patient may say, I'm frequently peeing, or I'm frequently urinating. Or they may just describe it. So they may say something like, I have to pee over 7 times an hour, which is obviously a lot. The second term is burning when urinating or burning when peeing. So an example is the patient may say, I get this burning feeling whenever I'm urinating. Number 3, urinary incontinence. Urinary incontinence. Example is, the patient's instances of urinary incontinence has significantly been reduced ever since she started the exercise program to strengthen her pelvic floor muscles. So the thing is that patients don't usually say urinary incontinence, but instead they will just give descriptions of what they're experiencing. So for instance, they may say something like, I'm leaking urine. Or they may say, I find myself running to the bathroom because I get these sudden urges to urinate, and sometimes I just don't make it. The fourth term is urinary retention. Urinary retention. So an example is, my bladder feels full, but whenever I try to pee, nothing comes out. The final category is signs and symptoms related to excretion. So the first term in this category is diarrhea. Diarrhea. So for instance, the patient may say, I've been having diarrhea for the past 2 weeks. The second term is constipation. Constipation. So the patient may say, I've been constipated for the past 2 weeks. Or, I haven't had a bowel movement for 16 days now. So bowel movement is pooping. And so instead of saying I'm experiencing constipation, sometimes patients will say I haven't had a bowel movement in this many days. Alright guys, that's it for today. Hopefully you learned something new from this video and you also enjoyed it. If you did learn something new or if you did enjoy it, please give it a thumbs up. And yeah, thank you so much for watching and I will see you in my next video. Thanks again. Bye.